Hello, and welcome to today's Lunch and Learn. Hyperbaric Oxygen Therapy, a breath of fresh air for health. I'm Dr. Steve Reinches, Senior President and CEO of NKC Health. Thank you for joining us. Today we'll explore the history of this treatment and how it can help patients heal faster. We'll also look at the latest research, safety considerations, and how to access this therapy. Our speaker today is Dr. Jim Maturo, Medical Director of NKC Health Wound Care. Dr. Maturo is board certified in internal medicine and earned his medical degree at the University of Kansas School of Medicine. He completed his residency at the University of Texas. If you have any questions during this presentation, please submit them using the Q&A feature below. We will respond to them at the end of today's discussion. And now, please join me in welcoming Dr. Maturo.
Thank you, Dr. Reiches. First of all, what is hyperbaric oxygen therapy, or we'll refer to it as HBO? It is 100% oxygen under 2 to 3 atmospheres of pressure in a specialized chamber. So how does this work? The increased oxygen in the tissues encourages capillaries to grow into the wound beds. This also reduces swelling and decreases inflammation. It also helps white blood cells fight infection, and it creates special oxygen radicals that helps kill bacteria. When do we use hyperbaric therapy? Well, we use it alongside other standard of care treatments, and we use it to help heal up difficult to treat wounds such as diabetic foot ulcers or tissue damage caused from radiation from cancer treatments. We've also had some new research in traumatic brain injuries. Recently, Joe Namath was treated with hyperbaric oxygen therapy to help CTE, and it had quite amazing results. We're looking at using it in sports injuries and even some severe cases of COVID-19. So a brief history of hyperbaric therapy. In 1662, there was a British doctor, or possibly a clergyman, named Nathaniel Henshaw, who theorized about using pressurized air to treat illnesses. In 1774, Joseph Priestley discovered oxygen and noted its healing powers. In 1834, the first truly usable copper chamber was made that could tolerate high pressures. In 1859, the first deaths from decompression sickness occurred. These were workers working in the caisson underneath the Royal Albert Bridge. In the 1860s, physicians introduced the first hyperbaric chamber in North America. In 1908, Dr. John Scott Haldane created the dive safety tables for the Royal Navy, earning himself the distinction of the father of oxygen therapy. In 1918, a local physician, Dr. Orville Cunningham, treated Spanish influenza patients with hyperbaric treatments. In 1942, we began using it for carbon monoxide poisoning. In the 1950s, they started using it to help aid recovery after heart surgery. In the 1960s, hospitals adopted it as a standard practice for serious infections and ischemic limbs. In 1967, the Undersea and Hyperbaric Medical Society formed to help develop and govern the safety guidelines for hyperbaric oxygen therapy. In 1983, the American College of Hyperbaric Medicine was established, and in 1991, the American Board of Preventative Medicine recognized undersea and hyperbaric medicine as a subspecialty, which allowed for certification. So in 1662, Nathaniel Henshaw first proposed hyperbaric medicine, but according to a recent NIH article, it's thought that he probably was never actually able to build it because of an unsafe design, doors that wouldn't seal, and dangerously high pressures. Also, they didn't account for unventilated carbon dioxide. So it took about 170 years before a functional hyperbaric chamber was able to exist. Henshaw was remembered for the idea, but not the practice of hyperbaric medicine. So back to our local doctor, Orville Cunningham, he was a anesthesiologist at St. Luke's, and in 1918 he was treating Spanish flu patients with hyperbaric chambers. And in 1921 he actually built a chamber here in Kansas City. This was at 3310 Harrison Street in Kansas City, Missouri. He then went on to build a 5-story hyperbaric chamber in Cleveland, Ohio. This was 65 feet tall, weighed 900 tons. If you notice at the very top, there's an observation deck here that they also used as a smoking porch. Now, if you think about it, oxygen under 2 atmospheres of pressure is highly flammable, so the smoking idea probably wasn't a great idea. So what happens in a hyperbaric chamber? You have 100% oxygen blowing into a pressurized chamber, usually at 2 to 3 times normal air pressure. Here at North Kansas City Hospital, we usually use 2.0 to 2.5 ATA. At 3 times the normal pressure of oxygen, the oxygen levels are so high in the body that you don't even need red blood cells to perfuse the tissues. And a famous experiment in the 1960s proved this. These Dutch doctors took pigs and put them in a hyperbaric chamber. They removed all their blood and they filled the pigs up with saline solution. The pigs lived in the chamber for a week, and at the end of the week they replaced the blood and they let the pigs out of the chamber, and they went on to fully recover as if nothing had ever happened. So how does this help? The oxygen helps blood to flow into areas where it's most needed. It boosts healing, it reduces harmful inflammation, and it activates stem cells. It also helps fight bacteria naturally. It makes antibiotics more effective. Why do divers get the bends? Well, when you're breathing compressed air underwater, the nitrogen tends to dissolve out into your blood and to the soft tissues. So divers have to come up very slowly to allow the nitrogen to leave through the lungs. And if you come up too quickly, it doesn't have a chance to do this. And so with the case of caisson workers, they routinely would come out of the caissons bent over in pain. That's because they came up too quickly and gas bubbles were forming in the joints. Today we have dive tables and dive computers that help us do those things safely now. So what can we use hyperbaric oxygen to heal? UHMS and Medicare have guidelines that we can only treat for certain things. So obviously we can treat for dive illnesses, we can treat air or gas embolism, carbon monoxide poisoning, serious crush injuries, severe blood loss anemia, brain abscesses, bone infections, tissue damage from radiation, compromised skin flaps or grafts, burns, necrotizing infections, gas gangrene, and lastly, sudden onset hearing loss. This gentleman is a professor of music at UMKC, and he went to bed one night in his usual state of health and woke up the next day deaf. And so he searched the internet and found that hyperbaric oxygen therapy could treat sudden onset hearing loss. He contacted us 11 days later. We got him in the chamber, and within 20 treatments, he regained 99% of his hearing. The caveat to this is a very time-sensitive issue. So unfortunately, by the time most people get to us, they've already lost their hearing and it's too late. We need to really see them in the first couple of weeks. So we'll give you a warning about potential graphic material here. We're going to show you some images of some wounds. This first lady is a spider bite, and this is the upper arm. You can see the bite was at the center, and you've got some swelling, you've got erythema, you've got warmth. This was after the first treatment. Here in this area, you're starting to see some tissue necrosis. but the swelling, erythema, warmth are dramatically improved. This was after 6 treatments. Here we are at 9 treatments. That area of necrosis is healing up, and by 10 treatments she had healed. This next case was a high school young girl at Park Hill who was out doing a science field trip, and she picked up a leaf and a baby copperhead bit her on the side of the hand. So you can see that she's got a lot of tissue necrosis in that 5th finger. The other fingers, she got a lot of swelling, erythema, and warmth. The concern was that she was going to lose a couple of her fingers. So this was at her first treatment. Here we are at treatment number 4. You can see that the fingers are a lot less swollen, a lot less red. There's a lot less tissue necrosis. In fact, she has some good granulating tissue there. Here we are at 9 treatments, and it's hard to see with the light, but the other 3 fingers are completely back to normal. And we now have good granulating tissue in the wound bed. She went on to make a full recovery. Frostbite. We had some cases of frostbite after the Chiefs-Dolphins playoff game at Arrowhead. That was the 4th coldest game in NFL history. And that really doesn't look like appropriate dress for minus 27. And consequently, we had cases of frostbite. And so this gentleman had a lot of ischemia in his fingers. This was after his first treatment. This was after 4 treatments, significantly better. We lost him to follow-up after that. He went to see his own physician in Springfield. But it was reported that he didn't lose any of his digits. Soft tissue radionecrosis. So this lady had a rhabdomyosarcoma and had radiation therapy, and it's hard to see, but the tissue was very, very woody. It felt like almost like stone or a log. Behind there was a draining abscess. So we coincided her treatments with IV antibiotics. This would have been after her 24th treatment. The skin was much more supple, very soft. The abscess was gone, no longer draining. She went on to heal as well. This was an ischemic flap. This is a below knee amputation. We got consulted because they were worried about the suture line here that was becoming ischemic. So this is at 2 treatments. You can see the suture line no longer is ischemic. It's got nice pink tissue. This was after 5 treatments. You got a little bit of an open wound here. And then at 7 treatments, they're healed. This was a diabetic foot ulcer. Have a lot of tissue necrosis here in the heel. This was at 13 treatments. We've now got good granulating tissue in the wound bed. This is at 17 treatments. Now you're starting to see the tissue filling in. And at 40 treatments, they're healed. This was another diabetic foot ulcer. This was a 5th toe amputation. This is the open wound here. This was at the 26th treatment. Here we are at 37 treatments. You can see now you got really good granulating tissue. And at 40 treatments, they're healed. We get a lot of diabetic foot wounds. This was a 3rd toe amputation. This was at the 6th treatment, and that's the amputation site here, healing nicely. This was at 37 treatments. So again, almost completely healed. And lastly, at 40 treatments, completely healed. The last patient, this is very interesting. This was presented to me as a diabetic foot ulcer. That doesn't look like any diabetic foot ulcer I've ever seen. In fact, it looks a lot more like a radiation injury. And so getting a little bit more history on this guy, it turns out that he was in the Marine Corps. He was part of a team that was inserted into Iraq, 6 Force Recon and 6 Navy SEALs. So they prepped the target, and after they were extracted, all 12 team members ended up at Walter Reed with these similar ulcers. Doesn't make sense. So I got to thinking about my time in the Marine Corps, and I remembered that sabot rounds have depleted uranium. Then I got to looking around, a lot of other shell casings will have depleted uranium. So I think what happened when they prepped the target site, the depleted uranium is now pulverized, mixed with the sand. The sand gets in their boots and socks, and they've got delayed radiation injuries. So we get him into the chamber. This was at 2 treatments. You can already see things are starting to get better. This is at 13 treatments. He's really starting to heal nicely. And here we are at 27 treatments and nearly healed. We're still seeing him currently, but he's really almost healed. And that's the end of my talk.
Well, that's a remarkable case. So what's a sabot round?
A sabot round, it's a long depleted uranium rod that is inside a casing that's fired out of a cannon. And the casing kind of falls away, and then you've got just a depleted uranium rod just sailing through the air under no propulsion.
Really? Wow. You ought to write that up. I don't know if anybody would have figured that out except for you.
So this guy, he got in contact with all the other team members, and they're all getting treated with hyperbarics now.
Well, you just saved 12 lives, 12 feet at least. We have some questions, and I'd like to read one from the audience. Would hyperbaric oxygen therapy help with peripheral arm neuropathy from a spinal cord injury that caused myelomalacia between C6 and C7? So spinal cord injury with secondary peripheral neuropathy.
It's possible that it could help, but the problem that we would have is that we don't have an indication here. The UHMS and Medicare guidelines would prevent us from treating something like that here. Mm-hmm. Oh. There are outpatient facilities here that they'll take your money and do it for you. It's possible it'd be helpful.
Okay. Well, what's impressive about your presentation today is how effective hyperbaric treatments are long after the exposure or the injury. It's very impressive to me. The Joe Namath story also was very impressive about head injury in sports. So here's another question. What are some common misconceptions about hyperbaric oxygen therapy?
Well, one of the big misconceptions is that you can go out on the internet and buy your own home oxygen chamber. I looked this up. You can buy them for anywhere from $1,500 to $10,000. They don't work. The reason why they don't work is because they only get up to about 1.2 to 1.5 ATA. You got to get over 2.0 to really have the beneficial effects of oxygen.
Mm-hmm. I know a woman in a retirement community who's above 80 years of age, and in the retirement community, they have group oxygen chambers, and they sell it as a fountain of youth kind of thing. I'm not sure that's really...
Probably not effective.
Probably not effective. Here's another question. How do patients typically pass the time while they're in the chamber? So, and also, how long are they typically in the chamber?
They're typically in there for 90 minutes. So we have the biggest chambers in the city, and they're very comfortable. You're going in with a blanket and a pillow, and you can take a nap, you can watch television, or we have hundreds of movies that you can watch on a DVD.
Just like home.
Just like home.
Okay, NKC Health Wound Care is one of the 6 Missouri hospitals that are accredited by the Undersea and Hyperbaric Medical Society. Why is this designation important?
It's terribly important for safety. When you're dealing with compressed air under pressure, you've got something that's potentially explosive. And that means we have to adhere to very strict guidelines. And This year alone, there's been 2 deaths in hyperbaric chambers, one up in Michigan and one down in Arizona. They're still being investigated, but I suspect that they probably brought something in the chamber that wouldn't be authorized. Here, our techs, Chris and Sherry, they're very meticulous about what goes in the chamber. If it's not authorized, it doesn't go in.
Okay. Here's another question. Does insurance cover for traumatic brain injury and stroke for the treatment of hyperbaric, using hyperbaric oxygen therapy?
I wish it was, because I think it would be very helpful, but unfortunately Medicare will not cover that. And if Medicare doesn't cover that, then your private insurance isn't going to.
Okay, okay. So what would you say to someone considering this treatment? How do they get the initial evaluation, consultation? Who do they contact? Just walk through the practical steps.
They can call us directly at the Hyperbaric Wound Care Center. I'm sorry, can you repeat the question again?
So tell us about the process. How do they get connected to the center? Who do they call? What is the initial evaluation? Do they see a doctor, a nurse, an intake person? Just walk through the initial steps.
They can call us directly, or their primary care can send a referral over. But they can call us directly, and you will see one of the physicians, either myself or my 2 other partners.
Okay. And are there any restrictions after hyperbaric oxygen treatment?
Only 2 restrictions. So if you're being treated for the bends, or if you're being treated for a gas embolism, you cannot fly for 48 hours, or you can't go above 10,000 feet. For all of the other indications that we would dive, the diabetic foot or the radiation injuries, those have no restrictions.
Mm-hmm. So you describe these treatments as dives. It's no diving involved. You get into the chamber and it's...
Right. But it's like being 33 feet underwater. That's the amount of pressure you're under.
So hence the kind of colloquial statement of a dive.
Exactly.
Good, good. Okay, well, thank you, Dr. Maturo. This is fascinating. I learned a lot today. So our next Lunch and Learn will be on November 6th. It's a Thursday. It's titled Brain Tumors 101, What's New and What You Need to Know, featuring Dr. Stephen Reinches, Jr. With NKC Health Neurosurgery. We hope today's presentation was informative and helpful. And once again, thank you for joining us. Have a good afternoon.